in the whole nation. If you have watched my last video where I titled does what does it worth it to get married early, ladies and gentlemen? So we just want to follow up with this live video. That's why God have laid it in my heart to invite this special guest today, whom I'm gonna introduce in a minute. Because some ladies, most of the time, we are just so much worried about our age of, uh, with reference to reproduction. So we want to have this presentation, which we have titled today, various, in fact, various fertility ways alongside with prayers, to encourage someone out there and to encourage even the young ladies, the couple that are married, that are facing this challenge today, that there are many options you can follow. Infertility should not be a problem or cause confusion or be a bone of contention in a relationship. In every temptation, Bible says there is a word of escape. There is a word of escape. So I'm going to introduce Dr. Loretta Oboro-Oko. Dr. Loretta Oboro-Oko earned her MBBS from the prestigious University of Benin in Nigeria. She has got masters in public health research from the University of Edinburgh and another master's degree in clinical education from the University of Sheffield Hallam, both United Kingdom. Loretta is doing a PhD in law and criminology at Sheffield Hallam University currently. She's a member of the Royal College of Obstetricians and Gynecologists in the United Kingdom, and she has worked for National Health Service for over 10 years. We thank God for her life. Dr. Oboro-Oko is so passionate about tracking women's reproductive and mental health issues. She's also a clinical stimulation expert and author of the book titled My Father's Daughter. Can you imagine? We thank God for this lady's life. She's a clinical educationist, a medical stimulation trainer, women and youth advocate. She's a motivational e-spacer blogger. You can check out that at www.lorettareviews.org. She's a humanitarian and global goodwill ambassador. And she is the president of University of Benin Alumni Association, United Kingdom branch. What a special gift God has given us. You're welcome.
Thank you very much, Auntie Angie. Thank you.
Thank you so much.
Thank you. You know, when you were introducing me, I was wondering, is she talking about me or is she talking about someone else?
It is you.
I am really humbled to have you today. And well done on the work you are doing for humanity. Well done. Well done.
Thank you.
And for all the support system you have, I actually say thank you.
We appreciate God. Yeah. So, we so excited, like I said, to have you here today. So, I want to just to talk to people who are watching us live at this time and people who watch it later about the various fertility options one can access while the person is still praying and asking God for blessing of fruitfulness.
Thank you. You know, when you asked me to speak on this subject matter, I actually thought about it because you said various options for fertility alongside prayers. So I was thinking, I said, so, what does Auntie Angie want us to give to the world today out of this? And it crossed my mind. It crossed my mind that man is And when I say man, this is inclusive of both men and women.
Mm.
Man is a being who holds on to something for them to actually keep being who they are.
Mm.
So we must all have that something that we hold on to. Even for people who say they don't believe in anything or they are atheists, somewhere in their core there is something they do hold on to, whatever it is. And I think what you are trying to bring out today is that when people are saddled with the burden of infertility, a lot of times we do run to prayers. But alongside prayers, irrespective of the religion, alongside prayers and spirituality, what are the scientific or medical interventions
Exactly.
that can prevail?
Yes, ma'am.
So I would say, starting off today, we will always pray like we are not working, and we will work like we are not praying. So that's the goal. And we must realize that the scientists, the doctors, the healthcare providers, the nurses, the pharmacists, even the porter you are going to meet in any healthcare facility, has been made by a bigger being, has been made by God in our case, because we are Christians. And the knowledge given to scientists is not from the devil.
Exactly.
It is from God, and they have put this in use for many years now. So while we pray, we also will seek the scientific mode or the medical mode to help in these problems. So without further ado, what do we aim to get out of this today? We will first of all look at what is the burden, what is the condition, what it is, and then what are the causes. How do you arrive at a diagnosis, or how do you arrive at which type it is, and then how do you then treat it, or better put, in a holistic manner, how do you then manage it?
Yeah.
But all the time, Auntie Angie, we must look at this in the context of our sociocultural, socioeconomic, and religious milieu. Wherever we are in the world, I think we must always bring that into the context of managing illnesses, diseases, or conditions, but most especially infertility. So let's start. What's infertility? Sometimes some people will say, oh, these days they want to call it sub-fertility, because they say, well, you don't just want to use a term and say, oh, someone like sentencing them to doom and saying, oh, infertility.
Oh, yeah.
So sometimes people are using it interchangeably, but there's a subtle difference. Infertility has been tagged a disease of couples. Let's all remember this: it is not one person's illness.
Yeah.
And I don't really like calling it a disease. I often would say it's a condition.
It's a condition.
It's a condition of couples. A condition of couples that affects the reproductive system. In which case, there is the failure to achieve pregnancy after 12 months or more of regular
sexual intercourse,
unprotected sexual intercourse without contraception. So there are some words I have stressed.
Yes.
There is no use you telling me now that, Larissa, I'm not able to achieve a pregnancy. And then I ask you, are you in the same house with your husband? You say yes. But he works in Aberdeen, and then he travels to London every 4 weeks. Or if you're in a place like Nigeria, you say he's working on the rig, and then he comes back to Warri every 2 weeks. Because you must have regular, unprotected sexual intercourse. People have often asked me, what is regular intercourse? And we have often said 2 to 3 times a week is what we will describe as regular. So now we know what it is, and we've put a time frame, isn't it? We've said after 12 completed months. The reason is because 84% of couples will conceive naturally within 1 year of them having regular, unprotected sexual intercourse. So that's quite a big number. Before they used to use 2 years, but then WHO
Yeah.
sort of changed the definition and it's now 1 year.
Okay.
So when this happens, bear in mind, I'll go back again, it is not one person's illness or condition. It is not a woman's problem.
No.
You find women running from pillar to post, especially in certain cultural settings. And you don't see men come with them to these consultations.
Like in
They
Africa.
will run from church to the hospital alone. Where are the men? It may interest you, and I'm going to come to that male factor infertility contributes the same percentage as female factor infertility. But we will come to that. But these are things that we should start thinking about. And just to make it so that you can reason with it, about 1 in 7 couples will have difficulty conceiving. So if you are experiencing this anywhere in the world and you're listening to us, you are not alone. You are not the only one. There are a lot of people going through similar things. And I think that's one starting point of getting succor. Okay? Now, we are going to then decide, because we now know what the condition is. Remember, I gave a guideline.
Yeah.
Now, what causes it? How can we sort of classify it? There is the male factor infertility. There is the female factor infertility. And there is the unexplained.
Oh, yeah.
So it can be caused either by a man's problem, a woman's problem, or it can just be unexplained. Now, I want us to step back and visualize something I want to describe. I want to make it really simple. So for a child to be conceived, two or three major things need to happen. And some of these major things are: 1, he must have a healthy egg, which is what is released by the woman's ovary. It must pass through a healthy channel, which is the fallopian tubes in the womb, because the womb, the reproductive organ of the woman, is made up of the womb, the tubes at the side, the hands, and then the ovaries on either side. Imagine them to be like some big orange, compared to every other cell. They are the biggest, just there, producing little seeds. So see those seeds as the eggs that are released every month. Now, nature wants those eggs to meet a sperm. That is the goal of nature. Once we are all growing up, nature is preparing us for reproduction.
Yeah.
And one of my professors says that after you've reproduced, you die. That's the next one. But you see, that's the goal. So a child is born, a girl child is born, and the ovary starts to develop, and a finite number of eggs will be released in her lifetime. So from when she starts menstruating, which is menarche, that's what we call it, to the menopause, when that stops, the goal of the ovary and the reproductive system every month is to fertilize and get a baby. So that seed, or that egg, as we call it, which is from the ovary, must pass through the tubes. The tubes are not just a pipe. When people hear it, it's a functional and structural tube. Functional in the sense that there are little hands, or what we call cilia, that beats, and they help that egg to move it. They're pushing it, like beating it towards the inside of the womb. So the egg is traveling down that tube. I've said something which is very important. We'll come back to it again. They are functional and structural, so they are beating. Now, when the man comes with his penis during sexual intercourse, and then he pours his sperm in the vagina, the sperm in that seminal fluid, that ejaculate, are going to start swimming. In fact, those are champions. They are trained to swim by nature. God has made them their sole purpose. There are millions of them released, but one is going to beat the rest, swim quickly and get to an egg and fertilize it, and then Very good, isn't it? And then that is going to embed in the womb. That is the goal. That is the beginning. Now, so you have certain functional and structural things that must happen. Now, just think along the way. If we are looking at the woman, first of all, where could things go wrong? So things could go wrong in this system at the level of egg release. So you may just find that there are some of us women where we don't have, so I'm looking at the female factors now, where we don't have eggs being released monthly. And some of the causes of this may be that we were not born with proper ovaries. We may have streak ovaries, like Turner syndrome. You have to do some chromosomal tests to find that. You may also find that we have something called, which is very common, polycystic ovaries, polycystic ovarian syndrome, where you have a whole lot of eggs all waiting to be released but never released. So we put on weight, we have hirsutism, but we don't release eggs every month. We have irregular periods, 3 or 6 months, no bleeding, no periods. And then you just have people who may have very low quality of eggs, okay? So that is at that level. Then imagine that the tube is blocked, or those, you know, those fingers I said push the eggs, they are not working. They've clumped. What do you think will happen? There's no place for that egg to pass through. So in that condition, you have tubal factors there. And that can happen if we have had an infection before, or if we have had an infection like chlamydia, sexually transmitted infections, or if we've had something like tubal surgeries in the past. Maybe we had some baby growing in the wrong place, going in the tube. One tube was removed, unfortunately another tube. If it's only one, there's no problem, because either tube, but if it's a two, then we do have problems. So it's like you've cut off the transportation mechanism between the egg and getting to the sperm. So very quickly we can move on to other things that could happen. The womb itself could have had an infection and things are stuck together. It could have been scraped too severely during previous interventions, like maybe D and C's and all of that, and things are stuck together. There is nowhere, uterine synechia, nowhere for anything to pass through. I'm trying not to use the big words. Just very,
medical
very
jargons.
Avoid it. Sometimes you may have conditions in which there are things or situations apart from PCOS that may affect fertility in women. One of such could be endometriosis. Are they in the ovaries? And then sometimes you have fibroids, but be careful, because most times fibroids are not symptomatic, they don't cause any problem. But in rare cases, depending on where they are, the number, whatever, are they blocking the where the tubes come in, whatever is happening with them, then they could present a problem with fertility. Again, you must remember that sometimes women are on some drugs that could stop ovulation and they don't know. And then there are some common drugs that could reduce fertility in women that they may still not know. One of the commonest is the non-steroidal anti-inflammatory drugs. And the commonest group in that is the aspirin.
Really?
Although be also careful that when you are pregnant, in early pregnancy, sometimes some women, they may need aspirin. But in that case, conception has already been achieved. Okay. Another group of drugs that could cause that, we have the neuroepileptic drugs and some other kind of medications. Now, importantly, don't forget that lifestyle could affect fertility in both men and women. Are we obese? Do we smoke? Alcohol, the byproducts of smoking can make things, the production of both sperm and the eggs, be of low quality. Okay? So now let's look at the male factors. What could make a man not have proper fertility? So it could be at the sperm production level. It could be that the at the genetic level as well. So some men may have things like Klinefelter's, Fragile X. These are big names, but you may need to do some chromosomal analysis. At the sperm level, how is the sperm? It's not just the number. You know, most men will say, oh, in my ejaculate, there's a lot of, it's very plenty. And I'm like, what do you mean? Not just the number. How is the structure of this your spermatozoa? Is it just head, no tail?
Oh.
Is it poorly formed? You know, that's all the things we look at when you do seminal fluid analysis.
Yeah.
Is it moving forward in a forward motion? Or does it not know how to move, turning around?
Exactly.
So these are things you need to know, and things that we look at when we do a seminal fluid analysis. And then you need to find out, did the man have mumps earlier on in life? Because, you know, sometimes there's that viral illness that causes swelling, and that could also affect the testicles. They call it mumpitis.
Yeah.
And you need to take that history. Now, what's the man's lifestyle like? Is he smoking? Is he obese? Alcohol? Using recreational drugs? Medications? Sometimes you see some men, they are gymming. Let me tell you, ladies, all those men that are gymming, carrying weight, taking anabolic steroid, you'll be thinking that muscle is equal to virility. Stop it. It's not, because most of them present in our consulting room with features of infertility, not able to achieve a conception, and the woman is fine and they have to stop the anabolic steroids. Okay, sometimes illnesses could cause it. Diabetes is one of such illnesses where men begin to suffer erectile dysfunction. So the sperm is fine, but there is no proper erection. That's also a problem. And also, let's not forget things like undescended testes as well. In some cases, trauma. So people who do high impact sport, rugby, even football, and they are busy hitting the testicles up and down, it can cause trauma. Now, something that's very common these days, people forget that the testicles are outside the body for a reason. That temperature suits the production of quality spermatozoa. It doesn't like heat. So anything that raises the temperature of that place, which is the engine room of the production of sperm, is not nice. So tight-fitting underwears, long-distance driving where you sit down, and riding bicycles all the time as well. You must wear the proper gear. Even when you are going to the gym, wear the proper gear. Now, laptops on your lap every day, 365, is not necessarily good for a man, because you are increasing the temperature of the testicles, and they are out of your body for a reason. So those are the possibility of male factors. We may come across many other things. Then don't forget that there's the group unexplained. In that unexplained, we'll check the man, we'll check the woman, we can't seem to find the reason. Now, in terms of percentages, it's been quoted. If you look at some literature, they will tell you 30% is male factor, 30% is female factor, and 30 to 40 is unexplained. And if you look at some literature, they will give you 40-40 male factor, 40 female, and the rest unexplained. So it depends on what literature you are actually looking at. So now we know the different possible causes. How do you make a diagnosis? I think I've already started talking about that. You come in, we will take a very good history. In fact, infertility consultations, they are long. Anytime I have to do them, I'm like, oh my God, I have to get ready. And they're also emotional. So as a healthcare provider, you have to be very empathetic, because these people have probably been from pillar to post. You know, so a good history, even from birth. How were you born? Oga, were your testicles in your did your mother ever tell you that your little balls were not there, and maybe they had to do operation, or later, you know? Did you have mumps growing up? This is for the man. Have you had sexually transmitted infections? Have you fathered any child in the past? We ask that question, but that question is not foolproof, because sometimes people father children that were never their own.
Exactly.
So when a mother-in-law comes and starts screaming on a daughter-in-law and says, my son had 3 children outside before he married you. As care providers in this business, we just laugh, because a DNA may just tell her that they're not necessarily her son's children. You see? But we take all of this history because they come in handy. And then for the woman, we need to also know any history of any previous surgeries, polycystic ovaries, endometriosis, fibroids, and our investigations are going to be based along that lines as well.
Okay.
We start with the simple things. Seminal fluid analysis for the man, where I've mentioned.
Yeah.
The woman, ultrasound scan, blood tests, tubal patency tests. So you want to make sure the tubes are patent. All of those things will go on. And sometimes we then need to treat. In treatment, I have made it 3 roles. One is conservative, and that conservative just means making lifestyle input, making basic changes.
Okay.
So if you used to smoke, you stop smoking. Both of you have to stop smoking. Both of you have to stop taking alcohol. Your body mass index, we advise it should be below 30. Okay. And then stop use of recreational drugs like cocaine, cannabis. They don't really help. Increase your exercises, release endorphins. We can send some people for counseling, because sometimes the problem may be at the sex level. So there are some women who find sex very painful. There are some men who have problems with erectile dysfunction. If it's at that level, you will notice that there is no way to bring the sperm to the egg. It's just that so counseling and sexual referencing or referral may help in that situation. And then you can go medical. In terms of medical, that means using drugs. So in women who are not ovulating, like those who have polycystic ovaries and endometriosis and some of those things, we could do medications. We could start with metformin, and especially in polycystic ovaries. Clomiphene, we can use that for ovulation induction. And some people do use tamoxifen sometimes as an alternative to clomiphene. Please, anybody listening, these are not over-the-counter drugs that you should play with. You must meet your healthcare professional and consult. Remember that we said take a very good history. Yeah. A proper one. There are some other bigger drugs that we call gonadotrophin, releasing hormones and all of that, that we use. But just know that these are drugs that affect, let me make it simpler, the way the brain controls the reproductive organs.
All right.
I think that's a simple way to put that. Then you have surgical intervention, where sometimes we have to go in, sometimes we do keyhole. It may be that we want to sort of what we call ovarian drilling, but that's a big term. It just means busting many follicles that are in the ovaries. It may be that. It may be removing some small fibroids. It may even be from down below. Whatever is needed, whatever intervention is needed, obviously. And then there's the big one I'm sure you want us to talk about, and we are there now. Assisted reproductive techniques. So when you've done all these investigations, you've tried all the other things, and people then find out, oh, okay, they've not worked. Okay, so what do? We can then go down the route of assisted reproductive techniques. And in these, you have IUI, which is intrauterine insemination. That's the simplest form of it. And then you have the IVF, in vitro fertilization. IUI, intrauterine insemination, means you take the semen, take pipette or a long tube with suction, and then you put it into the vagina straight. And you imagine this would be relevant for maybe people who have painful intercourse, they just can't stand it, people who have erectile dysfunction, or in couples where they are discordant for HIV and they are still having high titers. So this can come in for that. Then if you want to do that, we advise that you do it just after ovulation. And most women ask, when is my ovulatory period? We usually will tell you that from the day you see blood to the 14th day. The 14th day, plus or minus 2 or 3 days, will be your ovulation period. So it's important that you do keep track of your diaries, but don't become fixated. But what I find, stress is a major thing. In fact, I should say that when managing infertility, the first thing you need to do is cut out stress. But then it's difficult. How do you cut out stress? How do you avoid stress? So this is time you think about what two of you like doing together. Your hobbies, you know, things that can give you joy.
Yeah.
And this is actually the time you blot out, depending on what society you are in, you are going to blot out those societal stereotypes. Those, oh, what are people saying about me? You blot them out, because at the end of the day, there's something my daughter says. She says, YOLO. You only live once. So make yourself happy. Pray while you're in this course. And there's something I learned when I was in school. It's called on your own. So at the end of the day,
yes,
you're on your own.
Yeah.
And no two couples are the same. We must individualize your care and make it holistic to you. So don't come and say, oh, my friend, she didn't have children for 5 months. She swallowed clomiphene and she now had children. No, you're not your friend.
Exactly.
Your own may just be different. Okay? So that's IUI I talked about. Then IVF. IVF, simply put, is just that you go, you get the egg. Come on, I've got the egg. You go, you get the sperm. I've got the sperm. You get a glass, petri dish. That was where the first one was done. You put them together, fertilize them. Once they are fertilized, you have an embryo, and then you carry it and put back inside the womb for the woman. Summary. I've just summarized it, made it very simple.
Very simple.
But as you would expect, you do need certain environmental climate. You need the right temperature, the right pH. You need the right things to be done. But that's the summary of what IVF is.
Yeah.
Okay, where you take the egg, and it was Tiptoe and Co. who first did the first one. You take the egg, you take the sperm, bring them together in a petri dish in the lab these days, and you have an embryo you put in the woman. Sometimes you freeze them to save them. That's what they call frozen embryos for another cycle.
Okay. All right.
So that's how it happens. And for this to happen, you need to first of all suppress the natural cycle, although sometimes they use natural cycle IVF, and then you boost your own number of eggs you want to collect. Yeah. And when you boost the number of eggs you want to collect, you monitor the progress, egg tracking. You then collect. When you collect, egg retrieval, then you then fertilize them, and then you then transfer. Simply put. And there are some other terms that you have: ICSI, intracytoplasmic sperm injection. So that means you get, some men don't have adequate sperm, like you said. Some are not functional, their heads are too big, some don't have tails, they're not forward moving. So you go right in, you get them, wash them properly. Yeah, and then you now actually put them right into the egg. Okay. And other options that, because I don't want to go so technical, but other options that could happen is, are you using donor sperm? Because some men are completely there's azoospermia, that means no sperm at all, completely blank. So in that case, you could explore donor sperm. And these are some of the contentious parts in religion. I had a friend recently, I would like to use at this point real life example. I had a friend recently who, the man clearly was firing blanks, azoospermia, and his own mother would come to the house and insult the wife and say, you haven't gotten pregnant yet. Because in that social cultural milieu, a woman is responsible for everything. So, and each time they're insulting this woman, the man doesn't speak, he doesn't talk. So the question is, why are you not even defending me? And then they went for investigations and found out, okay, you have 0 sperm, we will have to use donor. And he said no, that he wants his own biological children. Now, how do you resolve this? He said, oh, in his religion, it stated that he needs to have his own biological children.
How will it happen?
So how will it happen? So this is why it's a couples problem. From the very start, couples must go together, and they need to understand that two of them are in this together, that decisions will have to be taken together. And then at the end of the day, thankfully, after a lot of counseling, because that's another thing, counseling works in a lot of these. After a lot of counseling, both of them then agreed, and then the task was to find a donor who had features like the man.
Oh, right.
So sometimes you could also have donor eggs being used, and in extreme cases you could have surrogacy. Surrogacy is where I have eggs, my husband is fine, but for some reason I'm not able to carry them. Maybe I don't have the room, maybe I'm just not able to carry them, like some people with cystic fibrosis. Different things could arise, and then you then get all post-cancer treatments in some people. So and they've saved their eggs, frozen them, so, or frozen their embryos. So you find someone who's willing to act as a vessel and carry that for you. So I think in summary, we've said a lot about infertility already, but we need to know that for us women there is a finite sort of biological clock. So it depends on which society you are growing up in, and it also depends on your own attitude. Do you want children? Because there are some women who don't want children.
I've seen
we
some.
must also understand that, and we must appreciate them as well. There are some couples who do not want children,
that's their choice.
but it's choice. Thank you, that's the word. But for those who want children, if you know you will always want a child, then start early to think about having a child. What I mean is, I find some young girls who, I mean, I studied medicine, so being in school, educating a woman can delay reproduction as well. And ideally, biologically, it is said you should have your children between the ages of 18 and 25. You should have had all your children, you know, because the eggs are optimal at those ages. There's what we call ovarian reserve. It's like a bank. You know, what's left, how good is what's left, and this can be fundamentally affected by age, especially in women. So get your priorities right. And don't waste time in the early years looking for a Prado driving rich brother, then you now add tongue speaking as an afterthought. I think know that you can fetch yourself anything as a woman. You can be anything you want to be. And in the process of being yourself, you would find that true person who appreciates you for you. It's very important, because you even find couples who marry for the love they have for themselves stick a lot stronger during the turmoil of fertility and infertility than those who maybe is RNG, or I married a fine man, or I married a rich man, because the cards will not follow you to the infertility thing. Neither will the millions in the bank account.
Wow! This is, I don't know, I like the word to describe this presentation. Thank you ever so much. This is real thorough, and she tried to use non-medical terms as much as she can. It's not easy, and it's very comprehensive as well. Thank you ever so much. So viewers, you have seen it. One thing you have to learn from this, there are so many things, too much. I can't summarize it. It's there. You can watch it and watch it and watch it as many times as you can. But one thing I want to drop off here, which it just touched my spirit. Infertility is husband and wife. You carry it, you are together in it if it comes to you. And you shouldn't attach stress and anxiety to it, because it's going to make the situation worse. Thank you ever so much. I'm going to ask you one or two questions.
That's fine. Okay. That's fine. Do we have questions from our audience as well? Not yet.
Okay, no question. All right.
You can type your questions in the chat box.
Yes, please. Type your questions, and we'll pick it up. So, what impact? I think we have really said it, but we'll just recap it again. What impact does age have in these available options?
It's important to know that as we go on, that when you are over 36 years, greater, in fact here in the UK they tell you that greater than 36 years or equal to, you should see the doctors a lot earlier than even 1 year. So that is to tell you that we actually factor in age in terms of, so the older we get, the more likely we are to have eggs that become um, either deformed, not adequate, and things just go a bit pear-shaped. You know, fibroids will tend to grow if you don't get pregnant on time, because estrogen, which is the primary hormone when we are not pregnant, it's feeding them a lot. And then there's something I'm actually trying to get, which is that if when in some countries IVF is very properly regulated, like in the UK, in fact, it's regulated. In others, it's not as regulated.
Okay.
So people can go in and put in 3 embryos, 4, even in people who are a lot older. But let me just tell you some figures that younger women are more likely to have successful IVF. And it's quoted that if you look at what we had in the UK, I think up until 2019, 29% success rate, irrespective of the kind of IVF, for women who were under the age of 35. Whereas once the women were over 44, it was only 2% success rate with IVF. So what I'm trying to say is that even with maximum intervention and treatment, you can see the disparity. So in nature, as we get older, sometimes we do batter ourselves. We've probably also gone ahead and done drugs, substances, different things that experience some illnesses, become diabetic. So overall, there's a lot of diminishing returns. However, just by virtue of nature itself, the reserves and the quality of the ovaries begin to diminish. Over the age of 40, you clearly having a lot of diminishing returns.
Absolutely.
So the advice is, if you want to do it, do it early.
Absolutely. Thank you so much, Dr. Loretta Boroko. So, viewers, you have seen the answer to this. Ladies,
Keep your chats coming.
You take the decision early enough. Okay? Just like what I said, and she said the same at the beginning. Going to see doctors, gynecologists, obstetricians, depending on your belief, is important as your prayers. So start early to go and take medical advice and all these investigations. Don't wait and only dependent, because God is using them. God gave them the knowledge. When we are poorly, we go to hospital, and it's the same thing when you have need for anything to do with fertility. You go and see a gynecologist. Don't wait and just praying and praying. Then after 10 years, and then your age is going down, and you have less options, or it will not be successful. Okay. So one more question then. Tell us if there's any chat question in the chat, please. What would you advise couples watching this live video today, or just going to watch it later, facing this challenge of sub-fertility? That is a better word, really. I've learned that. So what advice, which I think you have mentioned, you have really covered all my questions, but just recapping as a summary.
Well, I would say that the management of diseases is closely linked to the sociocultural and economic milieu of a people. So, though there are standards in science, there are other things that would affect the way conditions are managed. But there are some basic things that we can do for ourselves, primarily first. And I think I've taken out stress And how do you take out stress? I think in some societies it would be, first of all, protecting your wife, protecting your partner from the stereotypes and the attacks that society would throw at her. Because some people may come and say you are not praying enough, you don't have a war room in your house, that's why you are infertile. But that's not necessarily it, because it may be that the man has low sperm count.
I know.
It's not even the woman. You know, some people may come and say, it's the things you have done. I've seen in my own case, a relative's case, where they said it is the number of abortions that you've done in the past. And in that case, it was quite annoying, because this was a woman who was married by her husband as a virgin. But people came and made those remarks. So you must, first of all, protect your spouse from the stress. And then your spouse too must protect you from the stress. And so it's vice versa. It's not one way. So you need to also keep reassuring your husband, even though it's a male factor infertility, you need to be supportive. And you need to come to terms as to finding ways to work around it. You need to find hobbies. You need to find those things that will release the feel-good hormones. Find exercises that will release endorphins for you. You need to, and I told someone this today, you need to then make sex interesting, because it can become a chore at that stage. So you need to be inventive. You are not going to go into your bedroom and it's all scattered and I'm just tired, I'm looking for children. Sex is just for the function of having children. You still need to try and enjoy it, because when you take out this stress, the better part of the work is done. Then as a couple, you do need to pray. Sometimes you may even need to fast. It depends on your religious belief. But importantly, you must seek the right healthcare provider. I find that in some climes, a couple have infertility problem, and they are going to an ENT doctor. How does that work? Well, it's probably because they don't know. Take Nigeria, for instance. You go to a clinic, a private clinic, and they say, we treat infertility, we manage it. But the person there is a consultant there. It's probably an ENT person. It's okay if he brings in specialist gynecologists or fertility experts to come in. But sometimes they don't do this
claim to know everything,
because they want to make maximum gain
in Africa.
Okay? And then if you're in a place like the UK, you then need to know what are the guidelines. Okay, how do I get referred by the GP? Because sometimes even in the UK, it's postcode lottery kind of symptom. Because it is the CCG. How are they going to fund me? So you need to know, if my partner had a child before, are they going to fund us? And the answer is no. They are not going to fund you. If anybody has a child before. So you then need to start saving money and working together to go private. So you must make these plans. And you must make these investigations on time. Okay? Do you want to know at what age will they not fund me? At what age will they fund me? And then you want to know if at what age would they put in 2 embryos? Would they put in 1? Okay. Wherever you are, you need to sort of do all of it. And it's better when you do all these investigations all together. Our phones are not just for Facebook and WhatsApp. It's a whole new world with Google and Wikipedia. I know that not every information there is standard, but there are standard websites where you can get information from. Even in Nigeria, I don't want to start mentioning names of hospitals, because obviously we are not advertising here. But what I'm trying to say is that there are standard places where you can get information online. You seek this information together. You make the changes together. And then when it then comes to consultation, you go to the right care provider. They give you advice. They ask you, do this investigation, do that investigation, seminal fluid analysis, let's look at the sperm, sometimes we have to measure the testicles, sometimes we have to, because we want to know, are they smaller than usual, is something happened to them? Sometimes people have common illnesses like diabetes, could make a man lose his erectile function. And you just need to know. And that way, if you know, knowledge is power.
Yes.
You can then say, okay, how do I manage my diabetes? I need to have optimal control, and that changes the whole scenario. You have people who have psychosexual issues. Are you needing actually a sexologist and not necessarily a gynecologist? You need to know these things, okay?
Wow.
So that you know exactly what to do. And then even when you go down, you are going down this route, dietary changes are even important. What kind of food do I take? What kind of preconception multivitamins do I need? There's a popular one. It's so popular, I have to say, pregnant care preconception. It's good. Take one a day. Take fruits and vegetables. You know, there are some foods that are very, very fertility inducing.
Really?
Yes.
Wow.
But they can also make you gain weight.
Oh, right.
The highest multiple pregnancy rate in Nigeria, in the whole world actually, is in Nigeria. Somewhere in Baora in Yoruba land. And it's been traced to what they eat.
You see?
And it's been traced to yam.
Really?
Yes, yam contains a lot of progesterone.
Wow.
And that really, really increases their fertility. Now the problem is if you just say, oh, Loretta said yam, you put on so much weight, your BMI. But there's a way you eat it as well.
Small portions.
Exactly. You take little portions. And there are fertility improving diets. But I think one of the first things you can do for yourself is to drop your BMI. Because if you had something like PCOS full blown or even subclinical, that's one way to treat it. And most times fertility interventions with respect to IVF, nobody's going to touch you if your BMI is more than 30. Really? Yes, it's a requirement.
God bless.
It is a requirement. So these are things that couples should look into and do together. So apart from praying together, you must realize that if there's nothing we take away from here today, let's take it away that infertility is a couple illness, or a couple condition. You know, and we should take time together to also solve it together. I remember when I just finished medical school, and I was in Nigeria, and I was one of my professors, and a couple came in, and it was infertility, and and the woman went out when we were interrogating the man, and then the man went out, and then I said, but I thought you taught us in class that infertility was a couple disease, and he said, keep quiet. But the truth is that sometimes the socio-cultural milieu in which you practice may actually be limiting, but we must always strive as care providers, and I'm talking to my own colleagues now, as care providers, to do the right thing. Explain to people why you want to do the right thing, and most times they come around. They do come around. So engage. By the time you see your healthcare providers, it's not enough to see your healthcare providers and you don't engage. I saw something recently, really touched my heart. Some of the injections for IVF, the man was giving it to his wife. That's what I call teamwork. You know, and when women are taking these injections, it's not the time to start saying, why are you being lazy? Why are you just acting like those are hormonal injections? And they can change the mood, they can make them have foul mood, they can make them feel unwell, all sorts of reactions for different people. So support. I can't emphasize this enough. Support. And obviously, if you are getting older, and now this is maybe you are not yet married, or you are not in a relationship that you think is leading anywhere. I've had friends in the recent past go freeze their eggs. Make inquiries, yes. They've frozen their eggs. Sometimes if a woman has cancer and it's early and she's never had children, we do ask if you can quickly freeze your eggs before before you come round for treatment. So these are a number of things. And then there is this sore spot that in some cultures people don't want to hear about, but it's often an option for fertility. and that is adoption.
Mm.
So if you've tried everything, you've been from pillar to post, you've prayed, you've done your fair bit, you think the world just does not understand how bad you want a child. The truth is, we cannot say we are in your shoes, but we do empathize, deeply, deeply empathize. But that option is something we can also explore. But I find that sometimes in certain cultures and traditions, people don't even want to hear of it. You heard when I said about even donor sperm and the man went ballistic. How much more, oh, I want a child that's my own. But sometimes it's just not happening. Or maybe you are too unwell to have one, or having one could worsen an illness. Adoption could be considered as far as you do them in line with the legal requirements of the land.
That's it.
You should think and consider it.
Yeah.
And depending on your age, this is something that is coming out in certain countries, and we are experiencing it here as well. In the NHS, we have a cutoff age for IVF treatments.
Yeah.
But then you find that people go to less regulated parts of Europe, and they get pregnant, and then they come, and obviously on the NHS, we still have to treat them.
Oh, really? Good.
We don't have an option.
Yeah.
It is good, but then you can have a lot of complications fraught with it, and sometimes we struggle because IVF has its risk.
Okay.
Sometimes you have what we call ovarian hyperstimulation. Sometimes you have multiple pregnancies. You have to do fetal reduction. Sometimes it has a whole side effect fraught with it. But then I even find it's worse in places that are completely not regulated. I have colleagues and they are putting in like 4 embryos, 3 embryos in a 50-year-old woman, and it's but then they also explain that sometimes I forgot, please forgive me, I want to speak pidgin. They say sometimes people don't sell their houses, sell their land, because they do this IVF with me. Translated, it means people have sold a lot of properties and yet to do the IVF, so it's a whole lot of problems.
They want to put in
everything. But you see, the more you put in, the more you may have multiple pregnancies, eclampsia, pre-eclampsia. A lot of these women are old, and they are black women. Their blood pressure shoots up. We are battling all of that. You may lose those women. We saw what happened in Lagos recently, and this was a woman who was a principal in one of the schools, and she had nurtured many children through their life to become productive human beings in the world. And I'm saying, and yet she was saying, oh, the Bible says none should be barren. I said, well, you are not barren because you have nurtured so many children.
Yes.
So even though they were not biologically yours.
Yeah, but you raised them up.
So Auntie Angie, in this kind of program where we look at religion and we look at managing infertility, I think we should give an interpretation to that quote. Because that's one thing they come with. Oh, none should be barren in the land. The Bible says so. That barrenness the Bible is saying.
It's not only fertility.
No, it's not only fertility.
It's not to do with fertility alone.
The work of your hands.
Yes, productivity, everything that has to do
with
with
human beings have you mentored? Which human beings have you raised?
Yeah, that's it.
So as a couple, these are all things that you should look at together. And I think the best advice is to stick together through thick and thin. Take the stresses together. A stress shared is a stress solved.
Wow! Thank you ever so much.
You're welcome.
You've answered more than the questions I've asked you. Do we have any question in the chat?
Not yet.
Okay.
Can you think of any question, young woman? You've been listening to this interview as well as doubling as the camera woman and the director of this interview today. I would expect you should have a question.
She hasn't got.
Do you have a question from your side?
No, I'm really up to date about infertility now.
You are updated about infertility.
Yeah. I know this topic is a very sensitive one. Nobody, as a young lady not yet married, don't even want to hear it. But it is very good. You listen and take the information. Knowledge is power, because you will never know whether the challenge. I'm not praying. I'm not. Don't misunderstand me, but nobody will ever tell until you get married and then you start living together, and then you know whether you have this challenge. So acquire the knowledge and apply them as soon as you can.
Something crossed my mind that I have seen before in practice, and it has got religious trappings to it. So there was this young man who walked into a consulting room once upon a time with his partner, and they came because of infertility issues. But what happened was that and I want us to discuss this now, but it's a real life scenario.
Okay.
What happened is that the man had what we call hypospadias. So the opening of the penis was not at the tip, it was at the lower. So if this was the penis, the opening was not at the tip, it was at the lower edge.
Oh dear.
So that means that when he has intercourse, if he ejaculates, it's going to pour out.
Going in.
It's not going in. Fantastic. Now, they come in because of infertility. And when we examine the man, the first question, I remember then I was still a young student in medical school, and it was a urology posting. So they had gone to see the infertility experts, and then they were now sent to us in urology. But when my consultant then examined the man, the first thing he did was turn to the woman and say, "Did you not see this before you married him?" Which, by the way, is a question without emotional intelligence and situational awareness. However, but that struck me. And then the woman said, "No, I didn't see it." And he said, "Why?" He said, "Because we belong to a particular religious sect, and before we marry, sex is not allowed."
All right.
The consultant then turns to the man and says, "You are a very wicked person. Did you not know you had this problem? In fact, where are your parents? I want to see them." Because that's something we fix in childhood. And then he asked a question. It was really funny. But he said, "When you were doing pissing competitions with other boys, was your piss going far and straight, or was your piss dropping down your legs?"
Yeah.
I can talk about this and smile today, but this is an example of a serious case of infertility that had its trappings stemmed and rooted in religious practices. Now the question is, and I'm being the devil's advocate here, what would you say in that kind of situation? Because the woman had given a very cogent example, which my pastor would love, and that is that and you love that, no sex before marriage.
Yeah.
But here was the doctor who did not love that, because one, he felt, and he said, turned to her and said, "Will you not inspect your goods before you buy them?" And then he turned to the world
view about that.
And then he turned to the man and said, "You are not being honest, because even your Bible says, tell the truth."
That's what I want to answer.
So did you declare the truth to this woman?
This is it. The man, religion, I'm of the opinion no premarital sex. But the man should have informed the wife or fiancé. I have to tell you this.
What if he thought he was normal? Let's think about that. What if he thought that's how everybody's own is? Because when they asked him about the physical condition, he said he never did.
He should know. He can't deny that. He should know. Yeah, he should know. So, but the only thing he was like, I don't want to tell her because she may say no. But that is not that. If that lady really loves you and that lady is your husband, is your wife, that will not stop her. No, we need to open up to each other. That you're not having premarital sex should not be a hindrance to you saying any issue, any problem you have. You need to open up to each other to make sure that you understand the issue before you are getting married. I know this is the issue, and I love you, and I want to marry you, and I'm ready to carry the cross.
But we can see that some people do non-disclosure, as we have in this case.
Yes, that's
So,
the thing.
so I think
So they can go for an option, can't they, doctor?
yes. Well,
Collecting the
we
sex,
then
sperm.
decided to do for them in the first case IUI, and then at that point we, because they've not had a proper sex life as well, because it was apparent that the phallus was bent as well. So and then the surgeries came later, but it was also traumatic. You know, it was also traumatic, and this is sometimes where we become conflicted. As a Christian doctor, sometimes you really become really conflicted, and you are wondering, okay,
easy.
so what do I do in this case? How do I speak to these patients? How do I counsel them? And how do I counsel other people in the future? So I think that these things present their challenges, religion, fertility, sex, and all of that. But it is about sticking for the truth, and whatever is the truth. Because like you said, that man could have disclosed that at the very beginning.
Thank you very so much, Dr. Viras. We're gonna end here for today, and I hope you have learned a lot. Even if you are watching us today and you are not, or you are married, or you've got children, you can take it to someone who needs it. Ask them to subscribe to this channel to have this very educative and comprehensive information. We thank you so much. You are a gift to the whole world.
So are you.
May God continue to increase you and bless you. You are making impact.
Amen.
And bless your children. You receive your reward in Jesus' name.
Amen. Amen. Thank you very much, man.
Thank you. Thank you. Bye for now.